Saturday. I am Dr. Jensen. I'm a family practice physician. I'm located in the United States in Iowa. And I want to welcome you guys to Dr. J's Prescription for Health. I do want to start out by thanking you for being with me today. And I just want to acknowledge that. I think that when you spend time with me, I know that you are investing time in yourself. So I just think that's pretty neat. And so today in particular, I'm thrilled that you showed up. And I think that you will have a powerful experience and hopefully make some changes in your life. And sometimes it just takes, talking about it. So today, I want to start out. Good morning, Lucy. Thank you for being here. Lucy is one of my moderators, one of my blue shields, and I appreciate her being here. Watson is listening from Aspen. Where are you guys listening from? What city, what state, what country? I always like to hear where you guys are listening from. Today, I thought, how I usually start out my live streams is to talk about a topic and then answer questions or just simply answer your health questions that you have in general. So while I'm going over the topic of this morning, if you could hold your questions for a bit, and then we can go from there. But our topic for this morning is GERD, gastroesophageal reflux disease. Disorder. Basically, most people would say that GERD is heartburn, but essentially it is a lower esophageal sphincter that is malfunctioning. So it's the lower esophageal sphincter that's not functioning. So when you consume food, liquid, whatever it might be, it goes into our mouth, down our esophagus, and then it dumps into our stomach. At the lower end of our esophagus is a little door. It's a muscle. It's called a sphincter. And that sphincter opens and closes, or it should open and close. So when we swallow, the door opens, stuff drops into the stomach, and then the door is supposed to close. There are things that we do or consume that can decrease the tone of that lower esophageal sphincter and make it not work. What are some of those things? There are foods, first and foremost. For instance, onions, garlic, citrus foods, caffeine, chocolate, alcohol. There are other environmental or lifestyle things that we do, like smoking. That can decrease the lower esophageal tone. Obesity can lower the tone because the stomach your obese abdomen pushes up and puts pressure on that little door and forces it to stay open instead of closing. So the simple fact of obesity or pregnancy, that's why GERD is more common in pregnancy, because you got a baby growing in here and all of that pressure, pushes up, and then the stomach contents can reflux through that door. There's certain medications like calcium channel blockers that increase our risk of having decreased tone or increased risk of GERD. So calcium channel blockers, what are those? Like amlodipine for your blood pressure, or propranolol, or diltiazem. Those are calcium channel blockers and can increase our risk of having GERD, heartburn, reflux. That's that sour taste. You can sometimes get in your mouth. It's called brackwash. GLPs. The fancy Wegovy's and Ozempics and Mounjaros and Zepbounds and Trulicity, all of those can cause GERD. Why? Because when you take those medications, one of the mechanism of action is to slow gastric emptying. So you're slowing down the food dumping out of the stomach and into the small intestine. So you're going to slow that process down so food stays in the stomach longer. It has a chance to, under pressure, get pushed back up. When we lay down, it's even worse, especially if you have food in your stomach. When you lay down, gravity doesn't hold it down, so it's just backflowing, back and forth, back and forth, back and forth. You stand up, at least you have gravity pushing it down into the stomach or down, and then furthermore down into the small intestine. Now, what are complications of having GERD? Has anybody ever told you that having GERD is not a good thing? Do they inform you that you can get esophagitis? Itis means inflammation. So you're getting inflammation of the lower esophagus called esophagitis. Okay? You can get a stricture in that area. What is a stricture? A narrowing. Your whole esophagus at the lower 1/3 could get a stricture, meaning it just gets tight and narrow. And I'll tell you what, one of the first things I remember experiencing when I was a medical student, we did a rotation with GI. And the GI specialists usually work at the hospital because they're doing procedures. So they have certain days that they work at the hospital, and the students follow them around. You follow them for a month or so. And I remember that one of the doctors I was seeing we call it esophageal dilation. So there's these long probes, okay? So you knock the person out, and there are these metal probes, and they have different diameters. So you got little skinny ones, then you go up, 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 up. And what you're doing is basically putting the tube, that metal rod, down their throat to help expand the esophagus. I don't know if they still do it, but I will never forget this experience, okay? They would just dilate it, okay? And basically they would, go up and up and up until, sometimes you get some bleeding, and so they stop. So you're basically stretching that stricture open. And they will come back several times because you graduate. You got to keep doing it, or you're going to get that stricture back, which is basically scarring and tight muscles from constant reflux. Now, you could also get something even more ominous, and that is Barrett's esophagus. Barrett's esophagus is pre-cancer. It's a pre-cancer. It's from constant having reflux of stomach contents, acidity basically, into the lower esophagus. And yeah, you can get cancer of the lower esophagus, esophageal cancer. Now, what is the treatment? Well, the treatment historically has been taking a PPI, a proton pump inhibitor. It's basically blocking the proton pump of the parietal cells. It's blocking the hydrogen potassium ATPase pump. You're decreasing the amount of acidity in the stomach. You're making it more basic. So the normal pH of stomach contents is between 1 and 3, right around there. When we take a PPI, 3 or 4 hours after taking a proton pump inhibitor, your pH of your stomach can jump up to 6 or even 7, 6.5. So you're actually changing the whole dynamics of your stomach pH, the stomach contents. Now, when you do that, what are the consequences? Well, first of all, you're changing the pH. So if you do have GERD and you got splashing up into the lower esophagus, you're going to change the pH and hopefully not get as much damage, right? So you're not going to cause esophagitis because it was the really low pH that could have been causing it. You decrease your risk of getting Barrett's esophagus, okay? But what are the consequences? Does anybody ever tell you about the consequences of taking a medication? Especially in this case, we're talking about a PPI. You can get nutritional deficiencies. Why? because when we change the pH of our stomach, what was being absorbed, for instance, magnesium, iron, calcium, selenium, zinc, B vitamins, amino acids. Those are did I say iron? Those are the main things that decrease absorption when we change the pH. So God made us with a pH of between 1 and 3. And he assured us that we will be able to absorb the magnesium and iron and calcium and zinc and selenium and B vitamins and amino acids. He assured us that. But now we go and we play God and we say, oh gosh, you're having reflux. We're going to change the pH. So we're not going to really stop your reflux. We're just going to tell you that, well, you know what? If you got reflux, we're going to make it less cancer causing or less inflammatory. Okay. I guess that's a treatment. But when we change the pH and we don't absorb those nutrients and amino acids, which by the way is protein, you're also increasing your risk of getting infection. So let's talk about the complications of a PPI. We'll first talk about, we talked about nutritional deficiencies. Now we'll talk about the increased risk of infections, because the gastric pH at 1 to 3 is actually sterile. It blocks bacterial overgrowth in the stomach. So if you change the pH, are you encouraging bacterial overgrowth like H. pylori or C. diff? H. pylori is probably the primary bacteria for causing cancer. Just so you know, that's just a tidbit. So we're increasing our risk of getting infections. Okay, you're increasing your risk of getting cancer. Since the 70s, we have seen nearly a 10-fold increase of esophageal cancer, which is basically an adenocarcinoma. The higher gastric pH is supporting gastric cancer. Cancers love alkaline and oxygen. So they love a basic environment and low oxygen. So we're giving them the garden to grow, basically. Okay, what about our bones? What does it do to our bones? What does taking a PPI, a proton pump inhibitor, do to our bones? It decreases their strength. It can increase your risk of fracture. It can increase your risk of getting osteoporosis or osteopenia, which is the start to osteoporosis. Why? Well, bones are made of protein and bones have calcium in it. And if you're taking a PPI, your PPI is decreasing the absorption of your calcium. So if you are eating dairy, you're not absorbing all that calcium. And what about the amino acids? What if you're eating all the protein? You're not absorbing it. You've changed the pH of your stomach by taking a PPI. Now you can't absorb your protein as much. You can't absorb the calcium as much. And so your bones are made of calcium and protein, among other minerals, maybe magnesium. Well, we're going to decrease the absorption of magnesium as well. So, Lucy, do you want to have a talk with JM for a minute? Okay. So, the bone strength goes down and you increase the risk of having fractures. What about our kidneys? When we are taking a PPI, it actually increases our risk of chronic kidney disease, which basically you can look at through your GFR, glomerular filtration rate. It is a marker on your complete metabolic profile, your CMP. If you look, you'll see B1, which you guys call BUN, the creatinine, which is CR. Thank you, Susan. I appreciate that. So the CR, creatinine. And then the next one down is something called little e, big G, big F, big R, estimated GFR. It's pretty accurate. Okay? So you should have an estimated GFR above 90. Each stage, there's 5 stages of chronic kidney disease. Even if you were 60 you have chronic kidney disease. That's stage 2, actually. Stage 2 chronic kidney disease is an estimated GFR of 60. And most of your labs will have a reference range that just has greater than 60. Well, does that mean 61? Or does it mean 91? Or 101? So this is something that I don't believe that the doctors are talking about, okay? I don't know. You guys tell me. I'm a doctor, and I'm talking to you about it. But do other doctors talk about it? I'm not sure. I'm going to assume that they don't have time. Maybe that's a bad assumption. But if you're taking a PPI and your kidneys have an increased risk of chronic kidney disease or even acute kidney injury, were you told when you started taking your PPI? Okay. What about let's keep moving on. We're talking about complications of taking a PPI. We talked about nutritional deficiency. We talked about increased risk of cancer. We talked about your bones deteriorating, the bone strength, the bone density deteriorating. We talked about kidneys and acute kidney injury or even chronic kidney disease, CKD. And now I'm going to mention fundic gland polyps. So your fundus is the stomach. The fundus is the part of your stomach. There's 3 sections of the body, the fundus, and is it the tail? I can't remember, okay? Geez, that's bad. It just slipped my mind. Anyway, the fundus part of your stomach has an increased risk of getting these polyps. You've heard of polyps. Polyps grow in your colon. Now, why would polyps be growing in people who take PPIs in their stomach? In fact, 30% of users of PPIs will get polyps in their stomach. And remember, polyps can eventually transform into cancers. Okay? So, why is that? Well, it's due to something called gastrin. Gastrin is a hormone that is secreted when we are on a PPI. And gastrin is, you think of it like insulin or a growth hormone. Gastrin causes things to grow. When we cause things to grow, you can grow polyps, and then polyps can keep growing and then get cancer. Now, not all people with PPIs are going to get cancer. Not all people with PPIs. I only said 30% of users of PPIs will get polyps. But do you want to take the risk? Or were you told that there was a risk? Were you informed that there is these risks? You have to ask yourself. I told you earlier, another complication is lack of protein absorption. Remember, when stomach acid, you need stomach acid in order to activate pepsin. Pepsin breaks down proteins. So when I was talking about the nutritional deficiencies, one of those is a lack of absorption of amino acids because no pepsin to break it down. So if we change the pH of the stomach, making it basic, it doesn't activate the pepsin. If we make the stomach contents more acidic, we activate the pepsin. The pepsin can break down the amino acids and absorb them, and on we go. What about SIBO? SIBO, S-I-B-O, small intestinal bacterial overgrowth. How can we get SIBO from taking a PPI? Because that's the small intestine, and we're talking about the pH of the stomach and the PPI. Okay, well, due to the low pH of the stomach, when you eat or when you breathe even, you are breathing in eating pathogens at all times. That's why all food is inflammatory. So if you eat something bad, you hope that your stomach acid, which is sterile, will kill off whatever you ate. Now imagine you take a PPI, you change the pH, you make it more basic, which means you have less infection proof. So you're going to consume all of these pathogens, bacteria, viruses, fungus, parasites, whatever it is. You no longer have the first protective mechanism, which is your stomach. So some of those pathogens can creepy crawl out of the stomach and into the first part of the small intestine. And also, we feed, not you guys, not you listening to me. You're not feeding the bowels, the bacteria, the SIBO. You're not feeding those. What feeds them? What feeds those particular bacteria? They ferment, right? What are they fermenting? They're fermenting your sugar and your carbs and your processed foods and all of the crapola that you consume. So you're giving them free rent. Then they ferment, and then they cause your symptoms like gas and bloating and abdominal pain, and even you get diarrhea. That's all secondary to those bugs growing in your bowels and causing symptoms, okay? Another complication that I don't think people even think about is hyperparathyroidism. Now, how would the parathyroid glands be thrown off by taking a PPI, decreasing the pH in your stomach? Well, remember, one of the nutrient deficiencies that we can get is a lack of calcium being absorbed. So remember, most all positively charged minerals, positively charged, calcium, magnesium, zinc, selenium, iron, all of them are positively charged. All of them in the environment that's not acidic, so a basic environment, a more basic environment than what our stomach is used to. So a 1 to 3 versus a 4, 5, 6. So you're not going to absorb your calcium. So your parathyroid glands say, uh-oh, we don't have enough calcium in the blood. So your parathyroids become overactive trying to get calcium into the bloodstream. How do they do that? They suck it out of your bones and teeth. Then you get osteoporosis. I mean, right? It's a never-ending thing that they're not talking to you about. So the parathyroid glands become overactive. They want to get more calcium into the bloodstream because we are not absorbing it. It's crazy that, if you want a surefire way of stealing calcium from your bones and teeth, just take a PPI. All right. I don't know. Are there any questions on GERD, on the use of PPIs? I think initially when we gave PPIs, it was for a short period of time, maybe 2 weeks, maybe a month. But many people who are on PPIs, they take them forever and they want to get off of them, so they'll just stop them. And then their symptoms come back, and sometimes they come back even like more than they had before. So they say, oh, it's not gone. I need to take this for the rest of my life. Well, because their doctor did not inform them that they need to wean off the PPI very, very, very slowly, or else you will get a rebound, because your parietal cells rebound. They didn't see any acid, and then all of a sudden you stop the PPI, which was shutting those parietal cells down. Now you just release the gate and they go haywire producing acid, and then you get symptoms. Susan, why is a PPI taken? It's taken to decrease your symptoms of GERD, of reflux. So you can still keep your reflux, but you're just not going to feel it. That is what a proton pump inhibitor is. Prilosec, Prevacid, omeprazole is the generic name. There's Zegrid. There is all of these PPIs that are being prescribed to patients, and they're not being informed. And one that I failed to mention as a complication, I should have wrote it down. I got notes, okay? So I should have wrote this down, is it can increase our risk of dementia. Taking a PPI increases our risk of getting dementia. Why? Well, remember one of the nutrient deficiencies that I told you, that PPIs, they change the pH and then you can't absorb the positively charged minerals and ions? Iron. Iron is a positively charged metal. We need iron for our brain to function. You don't absorb iron? There goes your brain function, among other things that cause brain function to decline. Okay? So what Michelle asks, what is the best diet? First of all, Michelle, have we gotten rid of the things that cause reflux? Have you got rid of the GLP and the calcium channel blocker and the obesity and the onions and the garlic and the citrus fruits and the caffeine and the smoking and the chocolate and the alcohol? Have you gotten rid of all of the things that cause GERD? Because it's easier than telling you what to eat. I could tell you to eat a carnivore diet and your GERD will be completely gone. I can tell you that easily. It'll be gone. But maybe you guys need to decide, what is it that's causing my GERD in the first place? The gastroesophageal reflux disorder, disease. Then you can start working on the treatment. But if you're already on a PPI, you honestly, you guys, I've seen some really bad rebound. And so you really need to take this into consideration and wean off very, very slowly, okay? It could take months to get off of it. Susan says her GERD was from months or from years of taking diet pills. Which pill was it, Susan, in particular, if you don't mind my asking, that you can share? What is that caused, or you think caused it? Bound Forever made a sweeping acknowledgement that doctors nowadays don't know shit. Bound Forever, I think that might be painting with a broad brushstroke. I think there are some doctors that know a lot of stuff. But I do agree, we lack knowledge in many, many areas, and that's why we have specialties, and that's why we go to specialists. Yet, the specialists they might not tell you all of these things, because I've been talking for 28 minutes right now. What is the most amount of time that your doctor will spend with you? The average, just so you know, is 7 minutes. It took me 28 minutes to tell you what the definition of GERD is, what causes GERD, the symptoms of GERD, the complications of GERD. I'm still talking. It's 29 minutes. So it's maybe not that they don't know crapola. It's that they don't have time to talk to you about everything. They might not know. I'm trying to give them the benefit of the doubt, Bound Forever. I'm really trying to give them the benefit of the doubt. But I'm going to be perfectly honest with you. If I tell you that 5 years ago, I couldn't have recited this for you, is that because I don't know shit? Or is it because I was just never trained on it? I didn't spend the time on it. I mean, I could give you every excuse in the book. All I can say is, I don't know. I didn't know. I knew that there was a high risk of cancer. It was huge on my radar. I knew that. I learned it when omeprazole, when Prilosec first came out, okay? When Prilosec first came out, before it was Nexium, when Prilosec first came out, I remember hearing doctors, I would go to one of my favorite things to do, you guys, I love education. Well, back in the day, we didn't have textbooks, okay? Or we only had textbooks. We didn't have a computer. So you couldn't just go look stuff up. So you would go to these dinner meetings where a pharmaceutical company would hire a doctor to speak to other doctors about a medicine or about a topic like I'm talking to you about today with GERD. And they would talk about what I just talked about. They might not have gone into all of this stuff because were there GLPs back then? No. Did people talk about calcium channel blockers causing this problem? No. How about obesity? Oh my gosh, if you said fat or obese, you could go to the board of medicine. A patient could turn you in for calling them fat. You might not even have known said the word. You could have said obese. You could have said overweight, and they can turn you in. That's how bad it was. It still is bad. It's like shunned. If you mention someone's weight, so back in the day, like when we were doing hospital notes, when we'd write a hospital note, it would say 55-year-old white obese female in no apparent distress, who answers questions appropriately, who's alert and oriented ×3, person, place, and time. You would make that whole description, and we were writing it out. There were no computers. You wrote all this out. If you wrote that today and that person got your notes, they get themselves a lawyer, and then they say that they called them obese, white, female. Do you see where I'm going with this? So doctors just say, a 55-year-old, to protect themselves from getting sued. So do you think that they're going to tell you all these things? They're going to hope that when you went to the pharmacy, you got your medication, and inside the medication is something called a package insert, a PI, and that you took it home and you read all these things, and some of you actually did, and then you would bring it back to the doctor and say, but what about this? And then the doctor would gaslight you. What are you talking about? The risk of that are like less than 1%. Take the medicine. You got the disease. Do you want to get cancer? Meaning Barrett's esophagus, which leads to esophageal cancer. See how they gaslight you? You look it all up, and then you come back to them, and then they tell you how ignorant you are. Like, it's kind of like when they tell you they put you on a statin, and you come back to them and say, my muscles hurt. And they give you this, if that's pretty rare. I can't believe that you are experiencing this. If you want to die of a heart attack, then don't take your statin. But if you take your statin, you can suck it up. What's worse, a heart attack or a muscle ache? That is classic gaslighting, you guys. But you didn't know that. You might still not know that because you feel that the doctor knows everything. And why would the doctor hurt you? Well, the doctor's hurting you with their ignorosis. Ignorosis. Osis means a condition of ignorance. They're hurting you. I give this example all the time. If you had a bunch of money and you want to invest it, you hire a financial advisor. You're not going to just hand your money over to them, are you? You're going to ask questions. Well, what are you going to do with my money? What are you investing in it? How much fees do you charge? Well, if you do this and do that, what about my taxes? What about capital gains and capital losses? What about this? What about that? But when you go to the doctor, you say, I got reflux. They say, here's your pill. You got depression. Here's your antidepressant. You got blood pressure problem. Here's your antihypertensive. You got diabetes. Here's your anti-diabetic. You got obesity. Here's your anti-obesity pill, shot, whatever it is. Okay? We are not, in general, a healthcare that is giving you guys informed consent. And yet you are actually conditioning doctors not to give you any information. You just go with it. Are you going with what I'm telling you today? Are you just going to go with it? Or are you going to go, you know what? I was online and I heard this one lady doctor talking about GERD. I'm going to go check some of my other doctor people or chiropractors or functional medicine. I'm going to see if she's actually true that you don't absorb calcium and iron and zinc and selenium and amino acids very well when your pH is above 4 or 3. Oh, I guess she was right. So you went and looked it up. Because that's what you're starting to do. That's why I thank you for being here and showing up, because if you're investing in time listening to me, you're investing in your health, your time in health. You show me that you are interested in taking care of yourself. That's a good sign. I see all the names on here. It's a good sign. You guys want something better and you're not getting it from your doctor. Okay? Ken, I don't know much about wearables and wireless stuff. I can speculate. I mean, I can go down rabbit holes, Ken. I really can. I can go down any rabbit hole that you go down, and I'll say, do I really want to put a wearable on my body to give me more information about myself? You see, again, they're just going to give you a certain amount of information. And then you're going to want more because you're educating yourself and you go, oh, I want to know. I'm going to put a glucose meter on me. I'm going to put an Apple Watch on me. I'm going to get my heart rhythm and my heart rate, and I'm going to get my sleep and my stress and all of these things. Okay? I'm going to get all these things simply by wearing this. And who's getting the info? Do you think that you're the only one getting the information? No, it's going into the cloud, isn't it? Somebody's got to be looking at this information. I mean, do you want to get the Wi-Fi going through your body, the electrical energy? I personally choose not. I wear a 1990s Ironman triathlete watch. It is basically digital, and prior to that, I was just wearing an analog. Do you know how many people cannot even tell time with the seconds in the hands? If you have somebody draw a clock, they're going to have trouble. The new people, newly, freshly born, I bet they don't know how to draw a clock. Say, draw me a clock showing 11:15. They're going to look like they are failing the mini mental status exam. We're bamboozled by a lot of buffoonery that's going on, you guys. You know that. That's why you're here. You're the smart one. Yeah, if you guys have questions, Lucy, thank you. If you have a question, please put a Q or a QQQ in front of it so I can see it easily. Lucy's trying to point them out to me, but it gets hard. There's a lot of comments intermixed. And so here's a question. Are you a sports doctor? I am not a sports doctor. Do I know a lot about sports? Absolutely. Do I know about sports medicine? Absolutely. I was an athlete. I took great pride in knowing the muscles, the bones, the joints, how they move. I'm into function. Am I a functional doctor? No. Do I have to have, I don't know. Do you guys think it is necessary that if to be a sports doctor, you have to have sports medicine certificate or a sports, I don't know. what is the right thing? Or do you trust the person on Instagram who is just a trainer? I don't want to say just, who is a trainer, and they know about how the body moves more than a doctor. They're not a sports doctor. They're not a sports medicine anything. They're not even a doctor. They've never got their MD or DO or whatever. They've never been to medical school, yet no more than a doctor. Have you ever been to a doctor and you go, my elbow is hurting and I don't know why? And then they just go, oh, you have lateral epicondylitis. Here is your NSAID. Well, how did I get it? Well, you know what? Why don't we send you over to physical therapy? But why did I get it? Oh, the physical therapist will help walk you through that. Okay. Does that mean you don't know? No, I don't. Why don't you can come back. How about we get you maybe 5 sessions of physical therapy, and then you let me know if things aren't any better. And maybe we can refer you over to a sports doctor. I mean, tell me you guys aren't getting the runaround about this, okay? GLP, probably not. How about GL? How about G asks, how does one manage high hematocrit and hemoglobin after menopause. What is the definition of high hematocrit and high hemoglobin in a female for you? What are some examples of, or what is your example of high hematocrit and high hemoglobin for menopause? Okay. Ken asks, how does telemetry work? Telemetry, like on the telemetry unit, you have monitors all over you. You have a pulse ox, which is giving your oxygenation. And then that goes into a little box. You got your blood pressure goes into a box. And then that box is wired to the computers at the nursing station. I would assume, and you know what? I haven't been to a hospital. I don't know if they're using Wi-Fi now, but it was all wired before. Back in my day when I was doing hospital medicine, everything was wired. Probably everything now is Wi-Fi. It's Bluetooth. It's everything. You're basically, when you go into a hospital, you are in a Tesla. You are in a microwave. You have EMF going on all the time. Then they take away your sleep, and then they take away all your food and give you certain things to sustain your life, which is basically survival foods like oatmeal and waffles and toast, and give you some other processed food that's full of sugars and seed oils. And so basically you go into the hospital to get well, and actually you're getting sicker. So tell me I'm not wrong. I'm not wrong, but tell me. Lion asks, it's been 10 years since I had my first colonoscopy. They recommend to do another in 10 years. I'm concerned about possible complications. Do you feel that the poop in a box are a good alternative? Yes and no. If you do the poop in the box, like the Shield test, or you do the Cologuard test, it's checking DNA. It's checking your stool for certain DNA that could indicate cancer. If the cancer DNA is positive, then they recommend a colonoscopy. So what I always recommend is that before you do a test, when the result comes back, are you prepared to do something with it? The do something could be do nothing. That's something. When you do nothing, that is actually doing something. Okay? So you have to be prepared that what are you going to do when you find the results? All right? If you did the colonoscopy up front and they saw a polyp, they can remove it right then and there. Oh, yeah. Thank you, Anne-Marie. Welcome to my center stager. Thank you very much. I appreciate that. So you have to be prepared with, the answer you're going to get whenever you do any test. If you get a cholesterol test, are you prepared to do something with the results? If you get an MRI of your low back, are you prepared to get the results? What are you going to do? If you're not going to do anything and you know that you're not going to do anything, do you get the test? Do you spend the money on the test? I don't know. That's a decision you have to make. Some people say, yeah, doc, I'm going to get the test. I want to know. I'm not going to do anything with it, but at least I know, and it might encourage me to be more careful. I'm going to do less deadlifts with 315 pounds because I just found out that I have an L5, S1, or L4, L5 injury to my disc, or I got narrowing, or I got a bulge, or whatever it is. That might be just enough. That's the information you needed to make a good decision. So just be prepared, Lion. If you say, yeah, just do the box. Just put the poop in the box, get the DNA, but be prepared. If it's positive, what are you going to do with those answers? Are you going to do nothing, or are you going to do something? Are you going to schedule a colonoscopy? And look into it, Lion. Maybe your insurance will only pay for one or the other. And the box is only $500, but a colonoscopy could be thousands. So know ahead of time that your insurance will pay if they pay for the box. If the box is positive, if your stool is positive, are they going to pay for you to get the colonoscopy? Okay? Stin says, I no longer take any meds and don't have GERD anymore unless I accidentally get wheat gluten contamination. That's a horrible thought. How would you get that? Is that only when you go to a restaurant? And should you stay away from restaurants? Okay. I'm trying to, you guys are commenting in here a lot, and I'm just trying to go through and try to read questions. Okay. Looks like we got a lot of stuff going on here, but yet no. Susan says, I wear an EMF necklace and a sticker on my phone. I mean, I don't know if they work, Susan. I really don't. Are we being bamboozled with buffoonery? Are we being propagandized to now buy the little stickers? Are we, planting the even, even with me, I got all of these around the house to block EMF. I did not, up until starting this online business, I never had internet in my house. Never. I never had internet. Up until less than, it was last February or March. So I have never had Wi-Fi in my home up until then. And so, a friend said, you need to put this all over, okay? Because your phones, because of the Wi-Fi, your TV, the LED lights, everything. It's like you're in a microwave all the time. That's why it's very important not to just wear the things around our neck and the medallions, but we need to get outside. You need to clean your body out. You need to stand barefoot on the ground and discharge all of the yuck and toxins that are in your body. Do I know if it works? No. I don't have a sensor that says, oh, you have a lot now and you didn't, you know what I'm saying? It's hard to measure, but if it's real and if you stand barefoot on the ground and you discharge electrons and discharge a lot of the toxins, hey, it's worth it just to stand barefoot on the ground. GL says, how aggravating is it to have a doctor that ignores or discounts one's own questions or possible hypothesis on the body they have lived in for nearly 7 decades? I agree, GL. I agree that this is a problem, but we have hired the people to do that to us. You're actually paying to be gaslit. You're paying the doctor through your insurance and copay. You're paying to be gaslit, but you didn't know you're being gaslit until you educate yourself. And that's where education comes in. You have to be your own doctor. So I always say, who's the best doctor? The one staring back in the mirror at you. It's you guys, You know as well as I do that you can't rely on doctors. They're going to give you half truths and half information. What doctors are doing Saturday and Sunday live streams for 4 to 5 hours? Who's doing that for free? Look at who's doing it. Is it your doctor? Is your doctor getting online and giving out free information every Saturday and Sunday for 2-3 hours each time? No. I wouldn't do that. You make no money. Why would I give out information for free? Well, why wouldn't you? Are you that Do you need the money that much? Yeah, I got to put my kids in school. I need a new car. I got to pay for my mortgage and my taxes. Okay. Then I guess your priorities is not me, it's you. I understand that we're all human. I understand that we're all sinners. But if they're being blatant about it, no, not every doctor has to be online giving out free information. Not saying that, but what I am saying is for the GLs that are out there and saying every time that they go and look something up and then they come back and the doctor simply ignores them, poo-poos them, or discounts anything that they say, and they say, oh, you've been reading Dr. Google again. Isn't that what you hear all the time? People tell me that my doctors, oh, you've been reading Dr. Google now, haven't you? See, they get offended. I don't know, does that tell you a little something about the doctor? Like where their priorities are, what they're thinking? If they're gaslighting you into talking to Dr. Google, then they really don't care about you, okay? Because they just gaslit you. They just shamed you. I mean, how many people want to stand around and be shamed all the time? Maybe you're getting shamed already at home. Why would you want to go pay for a doctor to do it? You guys help me out. What is this black rock? Michelle is asking what this is. It absorbs EMF. Help me out, you guys. Those of you who know what this is. It's on the tip of my tongue. It's not coal. It is not coal. It's a type of rock that grows in the ground, obviously. It's full of minerals. Help me out, you guys. You can buy a big chunk of it and then you can break it up into small pieces. Maybe Lucy's at her computer and she can look it up. Boom, boom. Yeah, GL, tell me about the hemoglobin hematocrit. I don't understand that question. Yeah, I okay. Yep, Lucy is one of my moderators, but she's well informed. She's been with me for, at least a year or more. She's studied this stuff. So, if she's having trouble answering a question back to you guys, she'll let me know. Yes, I believe it is, Michelle. That is. I think that's what it is. Shungite. It's a shungite stone. I believe that's what it is. If I'm wrong, you guys help me out, okay? I don't mind being wrong. I don't like to be wrong, but I like to be right more than I like to be worried about being wrong, okay? So anyway, if Lucy does give you some information, please know that she's been studying it, and I don't think that Lucy will give you information that she does not need, okay? Thank you, Michelle. Michelle asked ChatGPT for the answer. That's what I was hoping for. Ask AI. Yeah, I agree. Restaurants can be hazardous. I choose not to go there. 3 times a year, I go out to eat. And I usually just get a steak with butter, and then I have to keep asking them about the butter. So then I don't put the butter on because I don't trust that that's real butter. They can fake it so well that I won't know. And I don't like that. So I just end up eating the steak. And then I bring some salt. Shady's asking about H. pylori, but I don't know what the question is. H. pylori is a bug called Helicobacter pylori. He's a bacteria that loves to grow in our stomach. Okay? Helicobacter pylori would rather live in an alkaline environment than in an acidic environment. Remember, the more acidic our stomach, a normal pH is between 1 and 3, it's sterile. So things can't grow in a sterile environment. That's why, if you have good stomach acid, you're going to not be susceptible to H. pylori and to C. diff and all of these other pathogens that love to grow there, okay? And we're taking them in, you know. Janie asks, not sure if you got my question. I did not. This is the first time I'm saying it or seeing it. Here it is again. Do you agree with a doctor influencer who says we should jump on boxes and hard surfaces to strengthen our knee joints? Should you agree with it? Do you agree with a doctor? Yes, I agree with box jumping. However, most people are not ready to start box jumpings. So you wouldn't want to just start box jumping to improve your knees, okay? Because you haven't figured out how to jump. You haven't figured out how to land. You haven't strengthened your quads or hamstrings or glutes. And especially a woman is at risk for the terrible triad, you know, an ACL, medial meniscus, medial collateral ligament tear. So we have to be very cautious. If the box jump was only 2 inches off the ground, I'm okay with doing a box jump as long as somebody is watching you take off from the jump and then land. We have to know how to accelerate into the air and how to land and not hurt our knees. So I don't know if that answered your question, Janie, but I think just diving into trying to jump as high as you can onto a box without first learning or knowing what the structure is of our knee. Did the influencer talk to about the structure of the knee? Did they say, don't do this until you've spoke to your doctor? Did the influencer tell you that, hey, if you're weak, maybe just do, in the air jumps and make sure somebody's watching to see if your knees are buckling or to make sure that you're not hyperextending your knee. That's where a trainer comes in, if they're qualified. I mean, there's a lot of ifs, but I imagine, Janie, that the information you're getting in regards to box jumping is factual. However, maybe Janie is not prepared to do box jumps yet. Make sense? Hi, Z-Love. Would you jump rope to do the same thing? I would jump rope for cardio, but again, I would want somebody looking at my knees when I'm jumping in the air and coming back down. Is my joint stable? Maybe you start out by you flip the rope around you and then you walk through it and then you flip the rope and you walk through because you have to develop strength. I would do sit to stands where you sit on a chair and stand back up, not locking out. You stay tight the whole time. You don't relax when you sit. Again, Janie, these are where you don't need to hire a trainer. I'm not telling that don't hear me say that, but maybe you need to get on YouTube and really study, strengthening the knees and getting range of motion. But just jumping into box jumps might not be for Janie. Organic says, I have had GERD since birth. So did you have pyloric stenosis, Organic Panic? Recently diagnosed with a hiatal hernia. So a hiatal hernia is a defect in the diaphragm where part of the stomach bulges through and into, through the diaphragm, basically. Now, do all people with a hiatal hernia have GERD? No. So look up if you don't know what a hiatal hernia is, just Google it and then click images and you'll see what I'm talking about, okay? You'll see that part of the stomach is bulging up through the diaphragm. Now, just because people have a hiatal hernia does not mean they have GERD. Does the hiatal hernia always cause lower esophageal sphincter problems? No. So I've seen a lot of hiatal hernias on x-rays and I'll ask, hey, do you have heartburn? No, I never even knew I had a hiatal hernia. Can you be born with a hiatal hernia? Maybe. You have a defect in your diaphragm, but usually the people who have hiatal hernias are obese or they've been pregnant, and all of that pressure pushes up and causes that defect. It's a hernia. A hernia is something that's inside now bulges through the walls that were holding it. Okay? So what, is you have an obese abdomen that's increasing the problems? So just because, you have symptoms of GERD doesn't mean you can't reverse it. Just because you have a hiatal hernia doesn't mean you can't reverse your GERD. Susan says her necklace is actually made of the stone that I was holding up, and she's got those stones around her home too. Good. I mean, I don't know if they're working. I guess you can get an EMF meter. That could prove it, okay? So if I put these in front of my computer, in front of my TV, in front of my phones, wherever that I'm at, I'm gonna put these in those areas in hope that this absorbs the EMF. So you could check your EMF by your phone, okay? Get that number, then put the stone by that phone, and then check the EMF again. I guess that would be the only thing, is to get a meter and see if it's working. Okay? GL says, you have been a godsend. Thank you so very much. I'm going to 100% agree with you that God puts us in places that's for his glory. I would have never thought I would be doing live streams every Saturday and Sunday for the past year and a half or however long it's been. I mean, here I am, a doctor. Why would I be getting online, sharing all of this information with people who want to listen or to disrespect me? It's a tough sell, okay? But God puts us in a position, puts people in our life, puts us for our learning, for our obedience. And it's not all just good stuff. It can be bad stuff too. It could be, it's tribulation, it's hardships. And he's preparing my heart for things. Sometimes I don't like doing this, okay? Because I get called names and it hurts my feelings, okay? Sometimes people will say something and I react. I react internally. I might not outside, but yeah, I don't like to be put down. I don't like to admit that I made mistakes in my life and that I wasn't the greatest doctor. And it could be that maybe I'm trying to make up for all the bad times. And maybe that's what God is doing, is saying, you know what? You did a lot of not so good things. You didn't inform patients. You treated them according to the propaganda and the buffoonery. You were of this world. And now I'm teaching you. God says, I'm teaching you. I'm putting you in a place where it's going to be painful. But you're going to get through it because I'm with you. So, yes, God sent me to you guys. But he's also teaching me how to be a better educator, how to keep things simple, how to see more patients, more clients, more listeners at one time than I could have ever done in my office. Yeah, it was great. I went from seeing 40 patients a day down to 10, and I patted myself on the back and I said, I'm going to just see 10 patients a day and I'm going to really give them good care. Well, at the same time, I'm paying rent and my nurse and my malpractice, and I'm going, I did it for 13 years and didn't save a penny, okay? And I just thought what God was showing me is all the hardships of insurance claims and had to hire billing. And, you get to the point where you start getting almost mean because you're so irritable inside that you start to project meanness or your sadness or your irritability onto your patients. And that is not good. I mean, 27 years of being beat down, and please do not feel sorry for me. I chose this profession on purpose, okay? Nobody talked me into it. Nobody tied my hands behind my back, but it's a journey. I'm on a journey with you guys. If I was seeing patients in the office, I would see them, spend 40 minutes with them, then 40 minutes of doing clickety-clack with them, after they left, I would have to go back to my computer and make sure I did all of the things that the insurance companies wanted you to document so you don't get sued and that they'll reimburse you. I see the big corporations can get around it. They got scribes and they got nurses who do all the things, and they even do the dictation while they're in the room with you. They're dictating while you're in the room with their face to the computer and their back to you. Tell me that's not true. I've been to doctor's appointments with my mom and my dad in the past. I know what goes on. I've learned a lot. I'm still learning a lot, and I want to share my journey with you guys. Some of you listening already know all of this stuff. You're way ahead of me, and that's okay. I'll catch up. Some are way below me. It's okay. You'll catch up. Yep, thank you, Mike. I appreciate that. Chung tight. Lucy, Shungite, yeah. Hopefully, Lucy, I told you what it was, and you guys got it. So, Europam says, I used to have H. pylori years, now it's cure, but I produce a lot of gas in specific complex foods I can't eat. You haven't gotten rid of it. H. pylori is really rarely ever cured. In fact, the chemicals or the enzymes, you will always be positive for H. pylori, always, okay? The bacteria, let's just say it's not H. pylori, it's some other pathogen that's in your bowels. You're having symptoms. The fact that you're producing a lot of gas and having, with certain foods tells you that the bugs are using those foods for their eating. You have bugs, maybe not H. pylori, you have other bugs, other pathogens that are eating the food you give them. So they're fermenting it and producing gas, and you're experiencing gas, bloating, and abdominal pain along with some diarrhea or constipation or whatever your GI symptom is. You're feeding pathogens, you're feeding your pathogens the food that they love, which is crap food, usually plants. Specific complex food. I have no idea what your specific complex food is. I'm guessing it's complex plants. All plants will cause it. We are not meant to eat plants. We tolerate plants. You're obviously tolerating them with the gas and the bloating and the abdominal pain. Marcus shares with us, Himalayan salt lamps turn positive ions back into negative ions. Is that a good thing or a bad thing, Marcus? I don't know anything about that. Stin says, my granddad and my husband's best friend, both doctors, my granddad and my husband's best friend, so your granddad was a doctor and your husband's best friend is a doctor, confirmed pharmaceutical companies send pretty young women representatives to market to doctors and give incentives to prescribe their products. Okay, let's talk about that. Is that true, you guys? Do pharmaceutical companies hire pretty young girls as representatives to market the products to the doctors? Is that true? I will admit, I rarely have ever seen an ugly pharmaceutical rep, okay? It's pretty rare. I mean, some of the older ones, as we age, we get, not so graceful looking, and they don't get rid of those older pharmaceutical companies because the doctors are older and pharmaceutical reps. So the doctors are older, and those particular reps have been calling on those particular doctors and the relationship. So it doesn't matter if you're not pretty anymore. The doctor has a relationship with you. They trust that rep, okay? Now, I have very handsome male reps as well, and they send the male reps into the female doctors. to market their stuff. And they smile and say nice things. They're like little models. And some of them are pretty intelligent. They've been trained. And when I say intelligent is they spew the propaganda really well. But if you ask them a question, they'll say, you know what, I better go look that up, which is fine. I'm glad they actually tell me. But here's the thing. Do they give us incentives to prescribe their products? You know what? An incentive could be a pretty smile, Stin. If they smile and they acknowledge that you're such a good doctor, that might be all I need for a dopamine hit to make me feel like I'm all that plus some. They might bring a cup of coffee. They might bring a soda. They might buy you lunch. Those are all incentives. They might give you a sample of their product to give to your patients. Isn't that an incentive? So is it true they give us incentives? Absolutely. It just depends on what your definition of an incentive is. I mean, you go buy a car and they give you a hot dog and they sell you. I mean, you can know what they give me, a hot dog. I'm buying from them. It's everywhere, you guys. So just because the reps are coming in, we should, as doctors, have some ethics and not be sucked in by the pretty faces. I don't know. I guess it's true. Lucy says, shungite is a rare black carbon-rich mineraloid, and it's, so mineraloid, so oid means similar to a mineral, and it's known for its purification of EMF. Well, there you go. Tammy says they have done that for decades. I've been in practice for 27 years, going on, and it'll be 28 in June. And there's always been a drug detailers, okay? Drug representatives, pharmaceutical representatives. That's what they want to be called, pharmaceutical representatives. And in all honesty, Tammy, the reps have educated me more on things than I ever got in medical school. I loved when reps would come in because I learned something. And I am able to, hopefully, able to separate being taught something and being not bamboozled by a product. We are easily influenced by the thing that could, like I said, you got depression, here's your antidepressant. You got high blood pressure, here's your antihypertensive. You got diabetes, here's your anti-diabetic. You got obesity, here's your anti-obesity medicine. Do they work? Yes, but why do you have the depression, the blood pressure, the cholesterol, the diabetes, the obesity? You just got the rep selling the product to the doctor. The doctor's been taught that's what they do. They make a diagnosis, they give your medicine, out the door you go, and you return to clinic in, I don't know, 3, 4, 5, 6 months or a year, and you go on with your life. So, chronic triggers is answering the box jump. So Janie, chronic triggers suggest to you maybe doing dot drills first. But again, watch how your knees are buckling, not buckling, and all of that. Yes, I believe in dot drills. We used to do dot drills in high school. Gosh, I nearly forgot all about dot drills. Lucy does box jumps. She's all the way up to 24 inches, but she didn't just start at 24 inches, or else she would have skinned her knees and bumped her chin and broke her teeth. What effect does drinking small amount of iodine have on the chemical? Hold on. Lay down. Tootsie, lay down. Be a good girl. I should have never talked to her. I don't have my little clicker here with me either. There she goes. I can't talk to her. Guys, can you excuse me for just 1 second, please? Just excuse me for 1 second. 1 second. 1 second. Okay, I'm going to keep going because maybe she'll stop. Okay. I don't know the effects of what iodine does in our stomach. I don't know. Do I think that the small amount that you're taking, 1, 2, 3, 4, 5 drops, I don't think you're having a problem. Marcus says, I'm taking amlodipine, a calcium channel blocker, ramipril, an ACE inhibitor, and atorvastatin, a statin for cholesterol. I keep getting my lower legs, ankles, and feet swelling. Any advice? Well, amlodipine, especially at 10 milligrams, I don't know what dose you're on. 5 milligrams, maybe not as much, but oh my goodness, you talk about a medication that increases your risk of peripheral edema. Amlodipine is it. So you're on a calcium channel blocker. I don't know what your diagnosis is. It could be heart failure. It could be hypertension, high blood pressure. Ramipril is used for high blood pressure. It's also used in diabetics. You have to ask yourself, are you ready to get rid of your high blood pressure, your heart failure, your diabetes, the swelling in your ankles? The advice is, what is causing all of these things? Why are you needing 3 of these medications? And can you reverse them? If the EMF is blocked, the device won't work. No, it will just not show up. It won't be as, the current will not be as high. Okay. Yeah, Susan, I think Amazon does have the meters. RM, I do not know why your teeth are covered by blood. I would look into it, though. I would see your dentist or your doctor as soon as possible. Stin says, have you heard of Dr. Boz? Yes, I have. Thank you, Rhonda. I appreciate that. Susan says people give every single live streamer heck. Okay, so this is a common thing. It's not just me, Dr. J. Whew. That's reassuring, although I still don't want to have that happen to me. Denzel says, why do the vegans claim we are not supposed to eat meat? I don't know. I don't know what they claim. I've never had a vegan on here telling me why I shouldn't eat meat. I don't know. Denzel says pharmaceutical companies definitely give incentives. Again, what is your definition of incentive? They're not writing us checks, so just so you know. The pharmaceutical reps have no ability to give us money, okay? The pharmaceutical companies themselves can hire us to lecture to doctors, like those evening meals, the suppers, the dinners. Those, yeah, then they can hire you and you actually work for the company. But they're not just writing you a check for how many scripts you write. There's no such thing. And if there was, I would have signed up a long time ago. I'm joking. I would have never. That's why I'm broke. Or not broke, but that's why I'm teaching for free online. I don't know why I'm doing it. Okay, how about kickbacks? I had a link. You could see any doctors and how much they were getting in these kickbacks. Yes, there is a link, but it's not a kickback. It's the incentive. It's the amount of, see, there's something called a Sunshine Act. And when we are given something like a soda or a cup of coffee or a lunch, it goes into the website. So they keep track of us. There's a government website that keeps track of how much money each doctor has been given by a pharmaceutical company. And that can be in the form of being hired. It can be in the form of a Coca-Cola or a cup of coffee or a lunch or whatever it might be. So there's multiple websites, okay, that you can see. You can plug in the zip code, the doctor's name, and it is public information because of the Sunshine Act. If you have a particular doctor and you want to check how much money have they made in it, but it's usually not up to date. It could be, for right now, you could be getting 2023 data or maybe 2024 data, but it won't be up to date, okay? So your doctor might have said, you know what, I'm done with the reps. I'm not accepting any more sodas or coffees or lunches. I'm going cold turkey. But yet you look them up and you see, well, they were lying to me. No, they might not be, because the data is so in the past, so it's just not up to date. So you have to be cautious, anytime, I could be thirsty and they say, I'll go get you a bottle of water. And then that goes down onto my tally, okay? I'm being tallied. And so you could look me up. I haven't looked you can look yourself up. I've looked myself up before. And I saw, what is that one? It'll be like $200. And I go, what? Well, sometimes reps are not so honest, and they might have put some of the other doctors on my tab, or they could have just bought something for themselves and put it on my tab. And I would never know unless I looked myself up. So yeah, there's a lot of bad apples out there. You guys already know that. Cody says doctors are paid too much nowadays. Cody, what do doctors pay? What do they get paid? Do you know the salaries of the doctors? They don't do that much. Okay. I guess that's Cody's interpretation of his world. Cody is giving us his interpretation of his world. He's probably the one that's sitting like this with their hands open and saying, gimme, gimme, gimme. And they're the vulnerable victim. Well, you should make that much money. You don't deserve anything, doctor. You should give your money to us. You should. Gimme, gimme, gimme with their hands wide open like this. You've seen the people, right? They act like the victim around everybody. They have alligator arms. The alligator arms can't dig into their own pockets, so everybody ends up buying for them. So Cody's probably one of those gimme, gimme, gimmes with their hands open. So pour the change in, because they're the ones that are talking about the doctors. So they're using fallacy arguments like ad hominem. So they're going to destroy the doctor's character because they can't really defend anything else. So that's the Codys of the world. Lucy says, I was checking on pediatricians for a friend. It was crazy the amount of them. You mean the amount that they were given as incentives? Right. I mean, that's a lot of sodas, right, Lucy? It's a lot of lunches. I mean, some of these reps will come in two to three times a week because they found that if they treat their doctor well, their doctor's going to do scripts. It is human nature to be influenced. We are overwhelmed with their niceness and their prettiness. And they're like the Codys of the world, where they will suck you dry to get what they want. And they will do anything they can. So it was on the 50K to 100 or 10K plus. So I'm assuming, Lucy, that particular pediatrician likely worked for the pharmaceutical company. So they are speakers. It would not take much. They will pay a speaker between $2,000 and $5,000 per hour to go talk to a bunch of doctors, and they'll even pay for the expenses. So if they wanted to send me to New York City to speak to some doctors at a steakhouse, they will pay for my trip. They will pay for my airlines, my car ride over to the airport. From the minute you walk out your door, everything is included, okay? The minute I walk out my door, from the gas in the car to the or Uber or whatever it is, to the plane ticket, to the hotel, to your meals, to what else? They take really good care of you. Okay, you don't even need to bring your billfold. You just need to bring your ID to prove that's who you are when you go to your hotel. And then they will pay you a stipend. And the stipend is for speaking for that particular trip could be $5,000. So really, Lucy, that doctor might have only needed to do 10 trips. What if they just went from La Jolla to San Francisco and they drove all the way there? They paid them for their time. Okay, so if it's I don't know how far it is. I just made that up. Let's just say it's 5 hours. They pay you while you're traveling. That's part of your stipend. So you can see where 50K could go way, way up. But I would venture to guess that particular doctor is a speaker for that. And a company in your area where you were looking up that pediatrician, a company might employ 10 doctors, okay? And they'll send those 10 doctors out to speak to the little doctors, okay? So, yeah, it's not really, is it a scam, Mr. Guerrero? Is it a scam? I don't know. I mean, picture this, you go into Lowe's and you go up to to one of the workers and you say, hey, can you help me pick out a good piece of wood? I need it for blah, blah, blah. Well, what if that employee was working for commission, right? Do you think anything of that particular person working for commission and selling you a board and then maybe upscaling you to a new screwdriver because you got to put, or a new bit for your drill? So you don't think about it in terms of the whole world. You only think about it in terms of a doctor being paid to go speak to other doctors. You know, it's happening all the time in every industry. Financial advisors, okay, so a financial advisor will get called on by a rep who sells bond ladders or annuities, and they'll wine and dine your financial advisor, right? They'll take them out for dinner and they'll give them, you know, whatever it is. They'll just treat them like a king or a queen. That's an influence. Now your financial advisor is incentivized to sell you the bond ladder or sell you the annuity or sell you the ETF. You know, that it's going on all around us. So is it a scam? Well, I mean, by definition, it's likely a scam, but you have a choice. Mr. Guerrero, you have to educate yourself to know if you're being scammed or not. You might get the information, have to go back and do a whole bunch of research and say, how much is my advisor getting paid on selling me the annuity? Yeah, it'll protect me and I'll get a 6% return after I retire and blah, blah, blah. But what are they getting? Are they getting 4%? Is it a no load fee? Is it an after load fee? Or what you know, you guys get my drift, right? You know, I'm not just trying to defend myself because I'm a doctor and I got influenced by pharmaceutical reps. I have already admitted that to you, okay? I probably made a lot of bonuses for those reps, sent them to, once a year, if they have a certain amount of scripts, they get sent to a pretty place on a cruise, and the doctors help pay for that. They were good salespeople. Who doesn't, you know, any company who wants to be good to their employees is going to give them bonuses and send them to fancy places for at the end of the year because they did so well. Well, the doctor was the one that wrote the script, and now you're blaming the pharmaceutical rep? I mean, I'm not giving a pass to the pharmaceutical reps, okay? But this is normal human stuff, okay? I think we probably need to do something about, Lucy, are you still here? Those doctors are getting compensation for all the study and time and knowledge they took. Yep, you're right, Susan. We took a lot of education and we're getting paid for that. So Cody doesn't understand that. And, you know, Cody, you know, has to slander everybody around them because nothing in life is ever fair. Lucy, I did a timeout on that one, okay? So just so you know. Okay, let me make sure there's no... Michelle says, biblically, the new covenants allow us to eat any meat, fish, or fowl. Is there a question behind that? Did I miss something in regards to that? I don't know. Okay. Did I miss any questions? You guys, if there is a question, we have breached a lot of subjects today. We went from, as a review, we talked about GERD, gastroesophageal reflux. We talked about the symptoms of GERD. We talked about the complications. We talked about basically normal anatomy. And then we got into paying doctors, financials. So that's just a little bit of a review. Oh, Michelle, what was the vegan comment? I'm sorry. Biblically, the new covenants allow us to eat. Oh, so why would a vegan tell us not to eat meat? Or, yeah, I don't know. I mean, they'll throw everything at us, and you carnivores will throw everything at the vegan. Have you ever thought about the fact that people just in the elites just want to divide everybody? Have you ever just noticed that? They want to divide you from poor and rich, red and blue, black and white, red pill, not red pill, Republican, Democrat. I mean, it's on and on and on with the division. And we eat it up. We eat it up. And because we are tribal, humans are tribal. We are clan oriented. We are going to side, even if we think something is wrong with our clan, we will side with them, okay? That is tribal. That is how elites get us, because they know that we are tribal. They know that we don't want to be left out. They know these things about us. So that's why it takes you guys learning discernment. And you can recognize division. You can recognize slander. You can recognize being gaslit. You can recognize being shamed. You can recognize somebody deflecting or projecting or doing these things to you. But if you don't study it, if you don't learn about human nature, you are going to get sucked in everywhere you turn. And some of us are more gullible than others. We just are. We're very trustworthy. We don't like conflict. We are people pleasers. All of those things come into context, and it starts with how you were brought up. So somewhere along the line, somebody's been studying you. They can sniff you out of a room. You're like blood in a shark tank. They know how to get you. They know how to hit your dopamine receptors. They know if they just give you a smile or a soda. They know that if they got you to eat one eclair, whatever they're called, a jelly donut, that they got you. They know if they give you a Dorito, they got you. They're studying you. Have you ever studied them? Have you ever studied a global flavorist? You ever studied what they do and how they learn it? What was their education? What was their background? A global flavorist. What about a rep? What makes a good salesperson? How do they influence you? What do they, there's a book that I have in my Amazon list, and it's called something about X-ray, and it's by Chase Hughes. And I'm going to read it, you guys. I'm definitely going to read it, because you can pick up a lot of cues from people. Maybe it's your doctor. Maybe it's your financial advisor. Maybe it's the social media influencer. Maybe it's the way they look to the right or to the left or to the up or to the down. Maybe it's how they hold their shoulders. Maybe it's how they smile. Maybe it's, you see what I'm saying? It's all of these things. And we are so trusting, and we get on the caboose with our tribe, and we got blinders on. Every one of you listening to me right now has been bamboozled, including the person who's talking to you. I can't even tell you how many times I've been bamboozled. But I learn, and I'm learning, and I will continue going at it. But I'm an honest person, or feel I'm honest, or it's something that I find great pride in, is to be honest. And I don't want to share with you things that are not correct. But that's going to happen. I can't be perfect, and I will share something with you that is not correct. I might tell you this is a piece of coal and it blocks EMF, and that's not true. But I thought it was coal. It's not. It's shungite. Okay? But I could admit, then I go back and I say, oh, I was wrong, you guys. When I told you that was a piece of coal, I was wrong. Yep, Janie, division. It's all about division. If I can get people, if I can cause enough commotion and enough chaos, I will get you guys to split up and defend yourselves. You'll defend me. I might be giving you all bad information, but you will defend me because I'm giving you free information, and you've been conditioned. Oh, Dr. Jensen is spending her time and she's doing all these nice things for us, and I'm going to defend her, even though she's been wrong a few times. I'm just going to defend her. She's my clan. No. You need to have discernment, okay? How does the person respond when you tell them that they're wrong? That's the question. Are they going to poo-poo you? Are they going to gaslight you? Those are the things that you need to get good at recognizing, okay? Denzel, I don't know the answer to that. Why do vegans claim that we're not supposed to eat meat? Because Michelle thinks it's biblical that from the new covenant that we are to eat meat. But eat meat, not eat meat, Denzel, you have to do it for you. Why does Denzel want to eat meat or not eat meat? Does it matter what I tell you? And I could share with you all of the negative things about eating plants. And I could put down the vegans and I can tell them that they're going to die. We all are, by the way, just newsflash. They might just have smaller brains and no muscle and die at 75. And you say, well, that's a good life. They have to decide. I can give you information about why eating plants are poisonous and all the things. And that if you're going to eat at least the safest of the safe, just be ruminant meats, salt, and water. I can tell you all of those things, okay? But what I'm doing is I'm telling you what to do, and I don't want to do that. So I'm just gonna give you information. You know, what is bad about a piece of broccoli or any other cruciferous vegetable? Okay, well, let's dig into the thyroid. Okay, let's dig into the serapines. Let's dig into all the other chemicals, the arsenic and the heavy metals and the non-heme iron and all of the things. I could walk through all of those things, and then you have to decide, am I going to eat broccoli or not? Okay? I'm not telling you not to eat broccoli. I'm not telling you to not go vegan or carnivore. I'm not telling you any of those things. I'm just telling you facts, or what I think are facts. Hopefully they are facts. Denzel said a doctor got arrested by the DEA for that same thing. What thing? What did they do? Oh my gosh. I get sent all kinds of stuff every single day. Sometimes I'll post them on threads. I never really post about the doctors, but I will post, other things. And here's why. All the stuff about doctors, it is actually public knowledge. Okay? Some of the things that we assume are really not public knowledge. And we might have had some inside information. But yeah, doctors are doing bad things all the time. But they're just human. They're a human, and they're an image bearer or maybe even a child of God, and they made a mistake. So, yep, the DEA will come in and they will take your license away, or worst case scenario, they send you to jail. But they're just a human. Doctors put their pants on the same way as a not doctor. We poop and pee and use a fork and do all the things that other humans do. So giving us any superior powers like superwomen and Superman, you guys, you're giving us way too much credit, okay? So don't be surprised when you hear something. Are you surprised when somebody steals and goes to jail for going to the Quick Trip and taking a candy bar off the shelf? No. He got caught because he subscribed or prescribed, so he prescribed Suboxone, Vicodin, Xanax, Valium, oxycodone to the same patient. Can you believe that? Actually, I can. I would love, you know what I would love, Denzel? I would love to know what kind of a person that is. What kind of a person is that doctor? Because I'm going to go out on a limb here, Denzel. I'm going to really go out on a limb here. And I'm going to speculate that that particular doctor did not do that to that patient nefariously. That doctor was likely a codependent empath fixer-upper who got bamboozled by the dopamine hits from the patient. And the patient continued to break boundaries with that doctor. The doctor did not have a boundary and allowed that patient to manipulate them. Over time, it got more. It started with Vicodin and Xanax. So you get the Vicodin for your pain and the Xanax to calm you down. And then you tried to get the person off of the Vicodin. So you went to oxycodone, some long acting. And then you tried Suboxone to try to get them off the oxycodone. And then they're getting nervous. So you give them some long acting Xanax, which is Valium. And you're just trying to help the patient and to make them comfortable. But at the same time, that patient manipulated the doctor who had no boundaries. So was the doctor nefariously trying to kill the patient? Doubtful, totally doubtful. But we've been trained in boundaries. But in fact, if that person, Denzel, gets reprimanded, okay? Nothing happened to the patient, praise the Lord, but now the board of medicine is going to send said doctor to a course to learn about boundaries. And you go to these courses and they'll teach you all of the doctor stuff, and then they'll teach you all of the illegals, like what you've done illegally. So you'll hear from lawyers and attorneys, and you'll hear from policemen and DEA agents, and they'll all speak to the doctors that are having to go to these courses. Some doctors take these courses just because. You don't have to be in trouble to take a course. They offer boundaries classes all the time, because I know it sounds crazy, but there are a subset of doctors that absolutely have no boundaries, and they are easily influenced by their patients. The patients are just like the pharmaceutical reps. They smile, they bat their eyes, they tell you how great you are, and they hit all of your dopamine receptors in your brain, and they can smell you like a shark, like blood in a shark tank, that you're an empath and a fixer and loyal and all this, and they'll only want to do what's best for you. And then the doctor gets in deeper and deeper and deeper until DEA comes and sends you off to jail. That's what I speculate is happening, and I am not defending that doctor. I'm just giving you a scenario that I think that you might not have looked at, Denzel. Okay. Europam says, I don't drink coffee, but will it increase my study performance if I do? Or is water the best way? Well, if you don't drink coffee, why would you go to coffee to increase your study performance? Why would you take a stimulant to increase your study performance? Have you looked at what is distracting you from your study performance? Have you looked at, or have you modified your study performance before adding a stimulant or adding something to something to try to get you to increase your study performance? Okay. Sherry says, awesome. I don't know what awesome is, but awesome is awesome. Talkaholic says, does it matter if you take different supplements together, like vitamin D or iron? Of course it does. It does. And I've given, one of my favorite examples is when somebody takes zinc and vitamin D and vitamin C. And you take it because you're trying to prevent getting sick, right? You're going to try to take it to increase your immune system. But we don't know that taking lots of vitamin D and zinc and, maybe vitamin C, what it will do to vitamin A. Those three things could significantly lower vitamin A. And if you lower vitamin A, then you lower copper. And if you lower copper, you cause iron to be pushed into tissues and locked up. So, yeah, taking different supplements together at high doses or just in what you would consider a normal dose can play havoc. You have to know that every physiologic biologic system in our body was meant to be. When we take something like vitamin C or vitamin D, we're interjecting something into the system to enhance a normal biologic and physiologic pathway. However, we could be destroying it at the same time. Let me give you an example. Let's go to the division on carnivores versus not carnivores, okay? Let's say you've heard that taking antioxidants is a good thing. So vitamin C, vitamin E, glutathione, whatever it might be. You've heard NAD, you've heard that you should take an antioxidant so you could improve your immune system. So I'm going to take some antioxidants, okay? Now, if you are a standard American eater, or even a vegan, you are going to be producing a lot of ROS, reactive oxygen species. You are going to produce a lot of oxidation going on, okay? And it might be beneficial because there's not enough antioxidants, or your body is taking care of something over here and leaving all of this for later, and there's not enough. So you build up ROSs, reactive oxygen species, all over your body in excess. Now, what you don't know is we actually need ROSs in our body, just not as many as we're getting. And so if you're taking in bad food, for instance, which is crapola, which is a standard American diet, or even I would go so far as to say it's not meat and it's all vegetables, okay, and fruit. I would go so far as to say that you are making a lot of ROSs in your body. And it might be okay for you to take an antioxidant. I'm not telling you what to do, but I'm just saying I could see where an antioxidant might be in that person's best interest to take care of some of the ROSs that are accumulating. Now, let's flip the coin and say, now we're talking to a carnivore or a ketovore, and they're eating basically an anti-inflammatory diet. They're eating meat and some eggs and some butter, and they call it good. And you give that person an antioxidant. Already, their diet of being a carnivore or a ketovore is very low in producing reactive oxygen species. Now you give them an antioxidant. Now you lowered their ROSs so much, they're getting a redox reaction. We need a certain amount of ROSs in our body to function. They're normal. We just either have too much, but if I give antioxidants to a person who doesn't need them and lowers their reactive oxygen species so much when their body needs them, now you just caused a redox reaction. You were fighting an oxidative reaction, and now you reduced it so much, now you got a redox reaction. That's not good either. So that's why I don't like when people are just haphazardly taking stuff without really looking into everything. Could you just get by with eating an animal head to toe? Absolutely. If you ate everything from their nose, head to their tail, you probably would live without any problems with your reactive oxygen species, unless, of course, you lived in a city smelling diesel fumes, smoking weed, drinking alcohol. No, you're not going to drink alcohol because you're a carnivore. You dig ditches for a living, and you're around mold, and you tear down people's drywall. So maybe it's not just your diet, but you can see where, wow, there's a lot of stuff here to know. And we listen to the influencers and say, take vitamin D for your blah, 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 because you're not eating cholesterol and fat. Take your vitamin C because you want to absorb your iron. Well, do you want to absorb your iron? Maybe you're eating plants. Maybe all you eat is non-heme iron. Do you want to take very high doses of vitamin C that's going to lower your vitamin A? And then your vitamin A is going to lower your copper. And then your copper is going to drive the iron that you're absorbing into the tissues, locking it up. And now you have no iron in your bloodstream. So your hemoglobin is low, your hematocrit's low. And your doctor tells you, take some iron. You take some iron, which is synthetic non-heme iron, with your vitamin C, which lowers your vitamin A and the copper. And then the copper drives it into. So now you're getting all of this stuff that you're consuming locked up in your liver, and it is rusting inside of your liver, because that's what iron does. Iron plus water plus oxygen causes rust, and now your inside of your liver is rusting, and the eyeballs are rusting, and everywhere where the non-heme iron was thrown into, trapped. Your hepcidin is high, your ferroportin's low. There's no moving it out. There's no moving it out. All because they told you to do this with the influencer. I mean, it's crazy, you guys. We can be so overboard trying to get healthy that we're actually causing problems. So do we keep looking for tests? Do we keep listening to the influencers? I don't know. You know, it's like you said, it's a catch-22. Okay. Thank you, Terrence, for the reminder. You guys, it's spring forward tonight, 2 a.m., I believe. Okay. Cold Peace says, would you say the culprit behind most diseases is EBV virus? I don't know. I am not a reductionist. I don't think there is any one virus or bacteria or fungus or parasite or carb or plant. I can't reduce it down to Epstein-Barr virus. I can't do it, Cold Peace. Yes, I have heard that Epstein-Barr virus, being a virus, could cause most all diseases. But what do viruses eat? Viruses eat sugar. Viruses eat iron. So now is it just the virus part, or is it do you have iron overload and don't know it? It's locked up in what we just got done talking about. It's all locked up in your liver. Well, that's going to feed the EBV virus, the Epstein-Barr. Isn't it going to feed every other virus and every parasite and every fungus? What about the sugar? The one that, that's causing you the gas and the bloating and the diarrhea and the abdominal pain and the cramping and all of that. You see what I'm saying? When we reduce things down cold, we put all of our chips into one basket. And never mind that EBV loves diesel fumes or loves, what are the e-cigarettes? What if we have all these viruses in our body? What if we have all the parasites and the fungus and all of this stuff? How do they live? Do they just live just because, or we feed them? Do they love certain atmospheres, environments, and not other environments? I don't know. Roxy, I don't think that's a medical question. You're welcome, Shelley. That might be true, Guy. I mean, who knows? I don't know. Sherry says, I always listen to my intuition. Sherry, enlighten me. What is your intuition? What is your gut feeling? What is that actually? I can tell you what mine is. What is yours? Joe says, carrots can't be good for me, please. Carrots. Carrots, why would you eat carrots? Carrots, oh, carrots have beta carotene. Well, what is beta carotene? Oh, beta carotene needs to convert to vitamin A. What beta carotene, they will tell you that beta carotene is vitamin A. Beta carotene is not vitamin A. Beta carotene is not a retinol. Beta carotene needs to be converted to vitamin A. But then you need an enzyme called beta carotene, BCOM or something like that. BCOME. You need BCOME or whatever it is, BCOM, in order to convert beta carotene to vitamin A. But in order to have BCOM, you have to have a functioning thyroid. You need T4, which converts to T3, in order to make BCOM, which is the enzyme that breaks or converts beta carotene to vitamin A. Well, what lowers your thyroid? Oh, well, I was eating goitrogens in the form of other plants, and those goitrogens messed up my thyroid, so now I don't have enough T3 or T4 to make the BCOM to convert the beta carotene to the, yeah. So, Joe, might as well just stick to the things that have vitamin A in them already. Beta carotene is not one of them. Plus, they're full of sugar. They grow under the ground, soaking up arsenic and cyanide and all kinds of other heavy metals. Yeah, they just can't be good for you. But that's just my opinion, Joe. Even meat contains some AMR. So at some point, AMR, help me out. I don't know your acronym. Or maybe I do and I just don't recognize it. Do you guys like eating bananas? They are my favorite food. I've rarely gone to doctors my whole life. We just didn't go. I got sick with stomach bugs and suffered through, just like menopause. Never went to the doctor, just suffered. Is it suffering? Well, what are you suffering with, Susan? And why? If you have stomach bugs, how are they growing? How did they get there? Spinal AVM, arteriovenous malformation, AV malformation. I've probably never have seen it in my entire 7.5 years. No. So heard of it, never seen it. Let's see. Okay, I'm looking for questions. I've never seen pseudo-hypoaldosteronism, and licorice cannot be good. Kidney retains sodium and water lose potassium. I'm not sure what your question is, but I think what you're talking about is the sodium potassium pump. Potassium loves to be inside the cell. Sodium likes to be outside the cell, but the inside of the cell tends to be more negative than the outside of the cell. So there's going to be less positive charge inside the cell as outside the cell. It's called the sodium potassium pump. And things that we consume or we can mess up our body. Our body's really good at maintaining that level. That's why you can check your electrolytes by your blood, and sodium will be in a reference range, potassium will be in a reference range. But when we eat certain foods or stick to certain things, we might lower, okay, for instance, how do we go there? If you are on a carnivore diet, for instance, especially initially, when your body's trying to accommodate to a carnivore diet, what happens is your insulin levels drop dramatically on a carnivore diet because you stopped eating carbs. Carbs are high, raise sugar, glucose. When your glucose levels go up, insulin will go up. So sugar levels go up. It tells the pancreas beta cells to secrete insulin to help keep the blood sugar at a certain level, okay? When insulin goes down, it tends to dump salt and water follows it. So you'll pee a lot and your blood pressure will drop. You could get hyponatremic. Now, if you're hyponatremic, what could that do to your potassium level? Remember, they're in a pump. So the potassium will tend to try to replace, because it's a positive charge. When we mess with sodium and potassium, especially potassium, we mess with our magnesium. Where potassium flows, magnesium flows. So if potassium is low, hypokalemic, low potassium, there is a likelihood that you're going to be low magnesium, hypomagnesemia, magnesiumemia in the blood. So there's a lot to look at, okay? If you're taking in a whole bunch of calcium, say, you decided I'm just going to eat a whole bunch of dairy products and you're actually on a calcium supplement like Tums or something like that because you have heartburn, okay? So you raise your calcium levels. What does that do to your magnesium levels? Lowers them. Remember, calcium is stimulating, magnesium is calming. You're getting so much calcium, magnesium gets depleted. If magnesium is depleted, potassium is depleted. You see where it's hard if you start taking a whole bunch of stuff, and now you're thinking about what your kidneys are doing, what your liver's doing, what your skin is doing, all of these things, and I just don't think that we're taking all of it into consideration. And I would have to look up all this stuff too, okay? All right. There's 1910. I don't know the answer to that real term. Why don't you tell us? Overcomer says, what do you do for cancer? Don't feed it. Lucy, there's got to be a conversion of a synthetic non-heme iron into an active heme iron or an active form of iron. From a ferrous to an Fe2 plus to an Fe3 plus. I don't know the conversion on, that's a great question, Lucy. I'd have to look it up. But there's an active form of iron versus an inactive forms of iron. Remember, there's, is it isotopes or isotopes of iron? Fe plus, Fe2 plus, Fe3 plus. Hydrogen has the same thing. Hydrogen usually has a plus charge, so it's going to be missing an electron, but a heavier like deuterium, I believe, I can't remember if it's negative, if it's given up its electrons or taken in electrons. But if you look at a periodic table, the periodic table, the closer you get to the sides, or it's hard to explain. I am not a biochemist by any means, but if your neighbor is on the periodic table, if your neighbor is, say, chloride, and the next one over is fluoride, or you're closest to oxygen, does your neighbor want to take an electron from you or wants to not take an electron from you? Because they're all trying to get to neutral, okay? They're all trying, that's why sodium and chloride go together. Sodium is a plus charge, chloride is a negative charge. They're 1-to-1. They love to go together, okay? Potassium chloride. Potassium is a plus charge, chloride is a negative charge. Together, they get married and they even each other out, okay? So they're either trying to gain an electron, like chloride is trying to lose an electron to potassium, who gains the electron to make it stable. Does that make sense? That is how the whole periodic table works. And that's basically how reactive oxygen species are working. So when you lower reactive oxygen species, you're actually lowering, you're giving up electrons. Okay? That was complicated. I don't even know if I gave you the right answer. But it's something like that. They told us to eat carrots because it's good for our eyes, because of beta carotene, which converts to vitamin A. But what if you can't convert the beta carotene to the vitamin A? What if you can't take the plant ALA and make DHA and EPA? These are good questions, right? How can we make sure our bodies are still producing melanin as we age? Melanin is an antioxidant, and a very good one at that. And I think as we age, it goes down in time. I'm always going to chalk everything up to keeping oxidation at its lowest. So the cells that are melanin producing are not dying. So maybe that looks like, Lucy, maybe that looks like fasting. And I'm going to go into autophagy, and autophagy is going to clean up bad debris and repair proteins and get rid of the foldings and all of those things. So I'm going to keep oxidation to its lowest in hopes that my melanin will stay high. Okay? I'm not going to smoke. I'm not going to drink. I'm not going to smell diesel fumes. I'm not going to do e-cigarettes. I'm going to go outside and be in the sun as much as possible. I'm going to sleep, because if I don't sleep, then I'm building up reactive oxygen species because of the stress, and on and on and on. So that's how you can make sure your body is still producing enough melanin as you age. It's just living all the same lifestyle, habits that I've been talking to. Eat good, sleep good, pray good, get out in the sun, run barefoot on the ground, all of those things. Johnny, it sounds like you might need to figure out why you have an addiction to the phone and food, and see a good therapist for your addictions. Find out, start peeling back the onion on why you are even having problems with addictions in the first place. Okay, it just happens to be your phone and food. So maybe going to going to a counselor, a therapist, learning, maybe going through EMDR, and finding out, hey, what's going on? But that's how you get rid of things. You need to see your doctor and get referred to a mental health specialist who is intrigued by addictions, can go deep into your childhood, and peel the onions back. Spinal AVN. I'm not sure. Ella, I'm not sure. Avascular necrosis. So spinal avascular necrosis. Let's just talk about avascular necrosis. Means something doesn't have, A means without. So without blood flow. And then without blood flow, there's no oxygen or nutrients. So things get necrotic. For instance, there are people that have hip necrosis because of avascular necrosis. So let's give you an example. I'm going to go way back in time and talk about Bo Jackson. Bo Jackson had avascular necrosis of his hips. I believe it was his hips. He got avascular necrosis. So his hip was basically dying. And so the head of the femur was sitting in the cup, and it was basically, the head was dying. It was getting no blood flow. So it was avascular. And so the head of the femur started dying and getting necrotic. Okay. So then the only thing that could help that joint was to replace it. So they go in and they chop off the head, and then they put a new probe down the middle of the center of the bone, and it has a new head on it. And they probably have to replace the cup because it got probably necrotic too, from the rubbing and the damage. But avascular necrosis is due to a lack of blood flow. Now, we could speculate on why people get avascular necrosis. They could have been born with it. They could have pinched something off. They could have taken steroids. All of these things. I've seen little kids get avascular necrosis. It's it's rare. I've seen Legg-Perthes disease. But again, in 27 years, I probably could count all of these odd things on one hand. I just am not qualified to even talk about them because I've never seen them. But you might see an orthopedic that all they see is avascular necrosis. So they get really good at spotting it. Okay, yeah, I'm sure an x-ray will tell you, but why does the person have avascular? Do we just go in and perform carpentry? Maybe. Okay. Let's see. I'm in Iowa. Yep, thanks. Thanks, Lucy. You know, I think most of these are just comments. Oh, here's a question I might not be able to answer, but let's see. Vince asks, is blood type needed for a factor when creating an everyday diet? Do the different blood types have characteristics that are vitamin and mineral specific? I'm going to give you the simple answer, Vince. The simple answer is, I don't think God made, how many blood types are there? A, B, O. Is there positives and the negatives? Is the neutrals, whatever the blood types are? Do you think God said, type A blood, you can only eat this if you want to be the ultimate human that I made you to be? Or if you're B, then you should only eat these foods. That would be, I don't know, I just can't get on board with saying type O should only be eating vegan stuff. Well, does type O have a cellulase enzyme that nobody else has? In other words, is a type O person born with cellulase enzyme and nobody else has cellulase enzyme? So the person who's got the O blood has cellulase enzyme and they can break down cellulose so they can eat plants and never have gas, bloating, and they can take all of the plants and they can live and survive and never need B12 and never need amino acids at all. They can just live on broccoli. Vince, I'm sorry, I just can't go there. I think that is propaganda. I think it's a way to sell something. I think it's buffoonery, and we've all been bamboozled. Okay? Marcus says, so should diabetics eat a meat diet? I think the question, Marcus, you should ask is, why wouldn't a diabetic eat meat? Overcomer says, what feeds cancer? Could be glutamine, could be sugar, could be iron, could be all of the above. It could be lack of sleep. Epigenetics. You have a gene and you feed it. Oh yeah, Shelley, that is good. Let's smash the like button, you guys. Dr. J is giving us real information to take on. Hopefully you guys are doing the notes. You guys, yeah, can you if you like what you hear, hit the like button, subscribe, share. It helps the algorithm. That's the Q word, right? But you know what? I'm just happy you're here. I'm just happy you're here. Yes, I would love you guys to hit the like button and the share and make comments and do the algorithm thing. But in all reality, because you're spending time here, it tells me that you're investing in you, okay? And that's what makes me happy. But yeah, hit the like button. That would make Shelley happy. Yep, Johnny says sugar and carbs feed cancer. Maybe you start initially with a keto and then prolong fasting. Lucy says primarily sugar, glutamine, pathogens, processed foods. Yep. Did you see that Dr. Bickman is now on the board of Diabetes Association? There is a separate American Diabetes Society, not American Diabetes Association. So Dr. Bickman was one of the original people on the board of the American Diabetes Society. So just so you know, it's if you guys want to go and learn more about real diabetes and how to treat it and, you know, diets and all that, maybe we stay away from the ADA and go to the ADS, American Diabetes Society. And I believe, Lucy, he has always been one of the original 7 that was on the board. Yeah, that's all I know. Johnny says, what are the benefits of taking 20,000 international units of vitamin D daily? I don't know. I would say that's overboard. Take astaxanthin, which had melanin and highest amount of antioxidants. Again, God is communion. Do you need antioxidants? Maybe Lucy is a carnivore and she's got just the right amount of reactive oxygen species that her body needs to survive. And then you take a whole bunch of astaxanthin, or however you say it, I'm sorry if I'm pronouncing that wrong, and you tell Lucy to take some astaxanthin, gives her more antioxidants. She takes a little bit of vitamin C and some vitamin E and then decides to take some glutathione. And now you just caused a redox reaction in Lucy and she ends up dying. God is communion. I don't think that you wanted Lucy, one of your sisters in Christ, or brothers, she's a sister, so she is your sister in Christ, to die because you told her to take some astaxanthin to increase her and to take the highest amount of antioxidants. I just don't think that you nefariously would want to do that to Lucy. Jim Rat says, what are your thoughts on peptides? Is there a reason that you need to take in synthetic peptides that your body can't get from food? That would be my thoughts. Um, 1910, good for you. Giving up, going in and buying from Goodwill. That's your addiction? Good. You know it, you've identified it, and you're going to avoid it. Let's see. Yeah, I know that, Shelley. I understand. Yes, habanero, Dr. Barry is one of the 7 founders of that. Dr. Barry, Dr. Tony Hampton, Dr. Bickman. There's 2 nutritionists, O'Hearn or something like that. That's 4. No, that's 5. Bickman, Barry, Hampton. Those are 3 docs. And then there's 2 nutritionists. Yeah, I believe there's 7. You always probably want to stay with an odd number. So if they get 8, they're going to get 9. So. Yeah, thank you, Lucy. You guys, we probably should cut this short, and I'm going to be back tomorrow. Hopefully you guys can be back tomorrow, Lord willing. I'll be here at 10 a.m. Central. If you want to sign up for consultations for me to evaluate and go over your labs, your medications, your diagnoses, and give you a game plan for you to talk to your doctor, I'd be happy to do that. Just, you can email me at IronLadyDoc@AOL.com. Lucy put the cost in there. It's by the hour. And yeah, sign up. If your doctor won't order labs and you live in a state that I can order your labs, I can do that for you and send them to you via email. Again, your insurance will not cover that, but it might be worth it. If your doctor won't order it, you really want it, then I guess you're going to have to pay out of pocket for those things. And it might be in your best interest to get, an idea of where you stand. A baseline is very good to have. Okay. Let's see. What else was I going to say? I think that was it. And then I can get to some of these other questions like, that you're asking, like, what is the best diet for cancer? Or, maybe the best diet is not a diet at all and it's not eating for a short period of time. I don't know. And then Blue Ocean, we can talk about GLPs tomorrow. There's just a lot of things that we maybe should cut this short. We've been talking for 2 hours and 20 minutes. You guys have really great questions today, and it does reflect on you and you're wanting to invest in your health. It makes me happy because I'm investing in your health as well, okay? That's why I want to do this, is I want to give you information so you can make informed decisions. If my information that I'm giving you is off, please let me know and we'll look it up together. But there's no reason to bash me or whatever, slander me or whatever. Let's just walk through it together. Let's not divide us. Let's, bring us together. If you want to eat only plants, let's figure out how you can, sustain that. If you want to eat just red muscle meat, eat steak every single day, we got to figure out how to sustain that, because you could just be low on something, you know. You could be low on glycine and not know it, because guys, okay? So we'll call it quits today. And hopefully, Lord willing, we will be back tomorrow at 10 a.m. Central. Bring your questions. I'll think of a subject. Today we talked about GERD. I like to get your juices flowing by talking about a subject. And maybe Lucy's got a subject for tomorrow. I can look it up and go into it. Joe, just ending on that. What about chocolate? You have to be the decider on that. What is the nutritional value of chocolate? Okay? All right. See you guys. Have a great Saturday. Have a blessed Saturday. See ya.